The alcohol ban and subsequent unbanning during the lockdown has certainly caused a stir among South Africans, with some saying that the ban should remain considering the burden that it does put on the healthcare facilities. Others are calling for stricter regulations. The draft liquor amendment bill has been cited as perhaps one of the ways to stop alcohol abuse. Maurice Smithers from the Southern African Alcohol Policy Alliance joins us now to discuss this. Good to have you with us this afternoon, Maurice. Now, from your perspective, is there a need for new legislation, or is the draft liquor amendment bill enough? Would it suffice if it were to be implemented?
Look, we would prefer if the liquor amendment bill was tougher, particularly on issues like advertising. There was a marketing bill in 2013 which has never seen the light of day. That would have banned advertising altogether. The liquor amendment bill does go some way towards controlling advertising, but it certainly would be a big first step. And in light of the current situation where the Minister of Transport is calling for more legislation, the Road Traffic Amendment Bill also should be going through. That exists and it's in Parliament. It should be going through, and that will help to get rid of drinking and driving.
Perhaps let's unpack these two bills and focus on the role that they would play in trying to regulate the use of alcohol in the country. Starting first with the draft liquor amendment bill, its contents.
Look, the basic thing that the liquor amendment bill tries to do is to give some effect to the new liquor policy of 2016, which is in fact based on the World Health Organization 3 best buys, which is the three things is to reduce availability, to increase the cost, and to ban advertising. So the liquor amendment bill, what it's proposing is things like raising the age of drinking to 21. It's placing more responsibility on liquor outlets for what happens in their outlets and holding them responsible for liquor-related harm. It relates to the hours in which alcohol can be available. That's part of the availability aspect. It talks also to the issue of where liquor outlets should be. So in each of those cases, what you're trying to do is to address the issues that are contributing towards excessive consumption of alcohol. They're not looking at banning alcohol or stopping people from drinking, but simply from controlling alcohol in a way that it won't be consumed in an excessive and dangerous way.
And when we focus on the road traffic amendment bill?
That's a very important one. Basically, we have in the country at the moment the blood alcohol content level. If your blood gets taken, if you've been driving and your blood gets taken, you're allowed to have 0.05 grams of alcohol in 100 grams of blood. And the road traffic amendment bill seeks to reduce that to 0. So what that would mean is that if you are driving, you simply cannot drink, and if you're drinking, you cannot drive. At the moment, there's a room for error because somebody will say, well, did I really drink too much? You know, was it safe? This will take that away completely, and that will mean that people will develop a new attitude towards the issue of drinking and driving, because any drinking and driving, any consumption of alcohol coupled with driving won't be tolerated.
Now, these are both bills. Are you aware of where in the process they are from migrating from becoming bills to becoming a law?
Well, that's a source of extreme frustration for us because the Road Traffic Amendment Bill has been in the making since 2012. The original draft of the bill was in 2012. There was an amendment to or a new version of that came out in 2015, and that's the one that has been put onto the parliamentary agenda for this year, but there's no indication of when it's actually going to be processed. And we're saying speed it up. You know, there's every reason right now to get that bill passed as soon as possible. in order to reduce the rate of alcohol-related incidents on the road. The Liquor Amendment Bill has been in abeyance since 2017. There was a quite intensive public consultation process that took place from 2016, but that's been in abeyance ever since then. Interestingly, when it went to NEDLAC in 2017, both the business sector and the labor sector called for a proper socioeconomic impact assessment to be made. That was done, and the company that did the work, Genesis Analytics, came up with a substantial document in which they said this bill must go through because it's going to save money and it's going to save lives. Why these things are not being passed, we don't know. We have been pressurizing government for years, and in fact, even now, we've been arguing that you cannot impose a ban because, by imposing a ban, government was saying there's a problem. Now, that problem has not gone away. So they've lifted the ban with incredibly minor restrictions now on alcohol, which is why since the 18th of August, we've had more than double the trauma admissions into hospitals in the Western Cape. There's been more, hundreds and hundreds of arrests for drinking and driving, including the death of 3 Metro cops in Tshwane a couple of days ago by a drunken driver, apparently. There's been an increase in gender-based violence cases as well. So we find it very strange that government didn't choose to, even under the state of disaster, impose stronger restrictions, but also that they're not looking at this legislation as a way to go forward. The irony is that Minister Mbalula, who has now called for stricter regulations and has called for a ban on advertising, admitted himself in a newspaper report yesterday that in 2013, when the marketing bill was accepted by Cabinet, he opposed it because he was the Minister of Sport at the time, and he said it would be against the interests of sport to have an advertising ban. Now he's the Minister of Transport, and he says we do need the advertising ban. So we need government to speak with one voice around this issue. And the focus has to be on public health and safety. So legislation around alcohol has got to be premised on protecting the people of the country of South Africa. That's got to be the main purpose of any legislation. Anything else must come secondarily, whether it's sponsorship of sport or even jobs. We're not saying that the industry must close down altogether, but we cannot talk about the liquor industry and their needs when people are dying and when people are suffering as a consequence of alcohol-related harm.
One thing that the minister has said is that going back and banning alcohol is not on the cards. It's not an option at this point in time. But what does need to be considered are stricter rules and stricter legislation. Do you think that the minister will now be looking at these type of bills and perhaps advocating for an acceleration into their passing?
Well, we hope so. One of the interesting things about COVID, what it has done, a lot of this focus has been on this issue of keeping the hospitals clear so that if there are COVID cases, that the beds aren't going to be taken up by alcohol-related cases. And also we're talking about not spreading the infection through, the immoderate behavior of people who've been drinking. But the reality is, so we still need to do that. And the reality is we're not succeeding, as has been shown from the evidence from the Western Cape of the jump in trauma admission since the 18th of August. But more than that, we need to think about post-COVID. And, we're talking about implementing a national health insurance scheme in South Africa. And a lot of people have said the country can't afford an NHI. Well, if we focused on health promotion, where we said that all of our legislation and everything that we do is geared towards encouraging people to live healthy lifestyles, to reduce the need for them to go to hospital, we will be able to afford an NHI, because then you won't have the hospitals having to deal with unnecessary cases. I mean, an interesting example that came up a few weeks ago is that it is said that if a normal stabbing, just a stabbing where somebody's got stabbed in an alcohol-related fight, goes into a hospital just to get treated for a non-dangerous stabbing wound and gets discharged, costs 5,000 rand. Now, who pays that 5,000 rand? It's the public health system. So why are we actually encouraging or allowing people to engage in behavior, drinking behavior, which results in a burden on the public health system, whether it's under COVID or not under COVID? So we believe that the minister, many ministers and provincial leadership have said we need to change the legislation. So let's do it. We think the minister's got to move quickly. All of the ministers who think that something's got to be done have got to put pressure on cabinet to say, let's get these things done. The portfolio committees in Parliament must actually put pressure on the executive to say, let's get these bills passed through. Because if we don't, we are simply going to return to the old normal, the same rate of death, the same rate of gender-based violence, the same rate of car crashes, the same pressure on the public health system, which is going to actually sabotage our attempts to have a national health insurance system.
Maurice, it's been good talking to you this afternoon. Thank you so much for your insight there.